have I got here? Snowfall countdown. The show will start in. Show started. Snowfall filter. Trying the filters. Right. Good evening. I've got some questions here, but as ever, just feel free to chip in if you've got anything to add to the proceedings. So I'm going to kick off with this one here. It goes something like this. Can I have a tummy tuck with a chest wall deformity? This is a patient who inquired, and when they said they got a chest, so basically the common chest wall deformities are either sort of an indentation of your sternum or a prominence of your sternum. Technical terms being pectus excavatum and pectus carinatum, which is where the sternum's either got a dent or prominent. And when this person first asked this question, when I saw that there was someone asking because they had a chest wall deformity, I assumed they were talking about breast implants, but they're talking about a tummy tuck. And the reason they're asking the question is because someone else has said they couldn't have the tummy tuck. And it's always worrying when you hear that, because I'm thinking, have I missed something? Because I can't see how a tummy tuck would have an effect on a chest wall deformity, or vice versa. There is an issue with, it would have been a better question with like kind of a breast augmentation, would have been sort of more common. Maybe we'll do that next week, but no, I'll do it now. But because the thing about breast augmentation is that when you have a chest wall deformity, and whether that be a chest wall deformity or a spinal malalignment, scoliosis, which can cause your chest to tilt. If your chest tilts, then you have got to be a bit aware of that if you're having breast augmentation, because the augmentation can accentuate any sort of asymmetry or tilt of the chest wall. So if you have a slight tilt with the chest wall, nipple might be pointing a little bit laterally. If you have a augmentation and augment that, the nipple will look like it's pointing even more laterally. So it can accentuate a tilt of the chest wall. So we would normally say to people, if you have a chest wall deformity, consider having the chest wall deformity fixed before you have your breast augmentation, although that might be a big thing, a big deal. And so some people say, look, I don't want to do that. And if they don't want to do that, then you have to say, well, you might get a bit of an asymmetry, etc. But this is breast augmentation I'm talking about here. So the patient who's asking about a tummy tuck, I cannot see how the chest wall deformity would have a bearing on the tummy tuck. Just can't see it. Not seeing it. So I would say, in my view, just based on that question, as it stands, absolutely fine. The only thing that worries me is the patient has been turned down by another doctor, which makes me wonder if there's something else. If it's not the chest wall deformity, if there's something else that they perceived it to be the chest wall deformity. So, what I would say to them, if you're out there, give us a ring. And well, I think they already have given us a ring. That's why I asked the question. But, we can do a call, or you can come to clinic and we'll discuss things and see where we are. And if I don't think you're suitable, or not, I'd say one of us, one of the team, one of the surgical team, because we've got a surgical team, don't think so, then we'll give you consultation feedback. So I know a lot of people worry about paying consultation fees if we're going to say you're not suitable. So if we say you're not suitable, or if you think, you know what, that was rubbish, of course that doesn't happen. I'm just saying, if it happens, of course it never happens. But in the very rare situation that might potentially happen, someone says that was rubbish, then you can have your money back, basically, because we don't want to abuse the situation. And a lot of people worry about paying the consultation fee. And to be quite frank, the money is mainly made with the surgery rather than the consultation fees, unlike other specialties where the main source of income is the consultation fees. Crikey, I'm digressing a bit there. But anyway, bottom line is, if we think you're not suitable, or if you're not suitable, then we'll give you money back. But I can't see how a chest wall deformity in itself could be a problem with a tummy tuck. That is my answer to that question. Drag that out. Khan is here. Good evening, Khan. Brad, Khan is, I don't know what that is, Khan. Is that a wave? But I know what that is. That is thumbs up, Brad. I'm a big fan of that emoji. Big fan. Nick has come in with a question here, but we've got stuff going on Instagram as well. Nick, hold firm, my friend. Hold firm. We're going to do Salma and Corin. Salma says, how long after, it's on Instagram here, how long after can you pick up children after a breast augmentation? Double after there, Salma, just pick you up on that. No need for 2 afters on that. We could have got away with 1. How long after, how could we done it in 1? How long can you pick up children after breast? No, that doesn't work, does it? Perhaps you did name both those afters. How long after can you pick up children? A breast augmentation. Okay, fine. Have both the afters. Have it your way. Okay, have it your way. If you want to afters, that's not what we're about here. Okay, we're not about the semantics. We're about facts. Okay, so let's do factual based answer to that question. So it's a difficult one, Salma, in terms of picking up children. So often when someone's having a breast augmentation, I will say first couple of weeks, you've got to take it easy, nothing heavy. So if you're doing the gym, if you're doing stuff with your upper body, nothing like that for a month to 6 weeks. So you can do lower body stuff after 2 weeks, which means the exercise bike, the stepper, nothing heavy with your upper body for 4 to 6 weeks. So if you're working in home base or if you're working in Amazon factory or something like that where you're needing to lift and everything like that, we'll give you a sick note and say, look, no heavy lifting for 4 to 6 weeks. Depends a little bit about whether they're under or over the muscle, a little bit more uncomfortable when they're under the muscle than when they're over, but broadly speaking, that's the same sort of time scale. But when you've got children, it's a different kettle of fish, because when you've got children, you can't not pick up your children for 4 weeks. I can't give you a sick note and say no picking up of your child for 4 weeks. So you will pick up your child. You know, if your child comes up to you and got the arms up and say, Mum, I need a hug because I just fall over and graze my knee, you're going to give them a hug. So what I would say to you is you just have to adapt and you have to modify. And probably if someone, you know, you will sit down and then pick them up from a sitting position rather than picking them up from a standing position to try and you know, mitigate that. So, you know, if that happens straight away, you probably will do it straight away. But, you know, if you can leave off it a couple of weeks, it's always good if your child is, well, I was about to say it's good if your child's a little bit older. Obviously, if your child's a little bit older, they're bigger, so they're heavier, but they're more likely to walk. That's why I normally say wait about a year for after having a child before having a breast augmentation, so that they may be able to walk a bit more. But obviously, they're bigger, so they're heavier. So, you know, how well can you pick up children? You know, ideally, if you can leave it a couple of weeks. And do you know what, Salma? It doesn't matter what I say. You're going to be uncomfortable picking them up in the first couple of weeks. So if you can have help around the house, that will be good. But the only thing you're going to do, well, probably the only thing you're going to do is make it swell. You're probably not going to do any desperate damage to anything. You're just going to make it swell the more you do. So if you can take it a bit easier and do a bit less of the old sitting up, then that would be a good thing to do. But it is always difficult when it's children rather than, you know, gym and things like that, because gym and stuff like that, you can eat, well, relatively easily not do it for a month, but children, you can't not do that for a month. Corin, what you got? Good to see you here tonight, Corin. JJ, how long do you recommend waiting between surgeries? I'm talking about a breast reduction and a full tummy tuck. Yeah, not uncommon, Corin, for people to want that sort of thing, a breasty thing and then the tummy thing, or vice versa. And what I would say, Corin, is absolute 110% minimum is 3 weeks. Months, 3 months. Probably 4 months. So maybe I should have just said 4 months. Okay, 4 months, Corin. Absolute rock bottom, 4 months. If you're desperate and champing at the bit. 3 to 4 months. But actually, the longer you leave it, the better. And I understand a lot of people want to get it done, just want to get it out of the way. But the longer you leave it, the better. They're both big operations, breast reduction and a full tummy tuck are both big operations, and they do take a while for you to heal. So obviously it depends on how you healed, assuming you've got no problems with the healing, etc., etc. Assuming everything's sort of settling down, how you're feeling it, they do knock you back for a good couple of months. So, you know, 6 months, there's no obviously there's no upper end to it, 6, 12 months. Personally, I would probably be happier around 6 months, just because your body's healed, everything's sort scars and all your tissues have settled and everything, because you don't really want to be going to another operation when you're still having the sequelae of the first. And it can take a good 3, 6, maybe even 12 months to get over these sorts of operations. So champing at the bit earliest, 3 to 4 months, probably more 4 than 3. Ideally, I would say 6 months in my view. But again, everyone's different, Corinne, and it depends on how you go, because you might heal really quickly and be fine, or you might like be a bit slower and things. So everyone's different, but that's ballpark. No sick note for when you have kids. Absolutely, Sam. I can't give you a sick note saying no lifting your kids. Yeah, I'll have to get help. Love you. Oh, thank you. No, thank you. Oh, God. You know what I read? Thank you. Love you. The psychologist would have something to say about that. Thank you. Right. By the way, love you vlog. That's it. Love you. Right. Okay. Well, I'm just struggling with the reading here. Love your vlogs. Thank you, Salma. Very kind of you to say. Oh God, what have I done? I'm blocking. Report, Terry. Terry, you just come up. I'm going to report you. I'm not going to report you. What's the difference, Terry? Big up yourself, Terry. Good to see you. What's the difference in the difference with over the muscle and under the muscle? So the difference, Terry, is that having them under the muscle does make it a little bit more uncomfortable. Does make it a little bit slower in terms of the recovery, and there are good and bad about them under and over. So the over is good because it's it's less recovery. It doesn't hurt quite so much because you're not cutting the muscle. It doesn't bleed as much, less chance of hematoma, a bit more comfortable. And the other thing about putting them on top of the muscle is the implant is in the same place as the breast. When you put them under the muscle can sometimes hold the implant high. Sometimes the muscle can hold it wide. If you've ever seen a very wide cleavage, that's probably when they're under the muscle and they haven't released the muscle enough. And sometimes you can get animation deformities, which means if you do the gym or stuff like that, when you move in your arm, the breast moves. So those are bad things by putting them under the muscle. So that would be good about putting them on top of the muscle. The good thing, so obviously, if anyone tries to tell you one's better than the other, I'd be careful. So obviously, there must be something good about it, because if there's any bad things about it, that's it. You wouldn't do it. So the good thing about it is that if you're slim, particularly when you can see your ribs, the muscle give it an extra layer of cover. They give the implant an extra layer of cover here up in the upper pole. So the muscle goes across like this. It doesn't cover them here in the outer and the lower pole, but it gives them an extra layer of cover, so you're less likely to see the edges, feel the edges, get rippling, etc. when you put them under the muscle. So under the muscle, less likely to see or feel the edges, but more likely to get animation deformity, or they could sit high and wide. So it's a balance. Excellent stuff. I've got 12 months in between. Music to my ears. Awesome, Corinne. Awesome. What we got? Sorry, Facebook. Nick, what you got? Hi there. I had 360 LBL. Nick's had an LBL. I'm assuming that's going to be lower body lift I'm going with. And chest reduction. No lipo, no MR. I know what that is now. That's not Mister, that's muscle repair. I have a bulge in lower tummy. Sorry, so he's a 360 lower body lift and chest reduction. No lipo, no muscle repair. Got it. I've got a bulge in lower tummy and there is looseness when I sit down. How long does it take for the swelling to fully resolve? Is there a chance that the surgeon did not remove enough skin? Finally, do you perform revision TTs, FDL with lipo, Renuvion and MR? Whoa, not that he doesn't know what he wants. This man knows what he wants. He wants revision TTs, FDL with lipo, Renuvion and MR. Oh, right. Nick. So first question, I'll look at that. I've just looked down on the comments there, Nick. And I see Mrs. K's asked a question on YouTube. Oh, wow, look at that, Mrs. K. I will answer your question, Mrs. K. So, Nick, I am 2 months post-op and noticed an ab board with the compression garment helps to reduce swelling a bit. Okay, so that was the first thing I was going to say. Nick, first thing, Exhibit A, Nick, you've had massive surgery, a lower body lift and a chest reduction, massive surgery. Number 1 point. Number 2 point, you are 2 months post-op. You are way too early to talk about revisions. You know, I just said, when I was saying to Corinne, like minimum 4 months between surgery, I was talking there about different surgeries. You know, she was talking about breast reductions and a tummy tuck, different parts of the body. It's even worse if you're going to go back to the same part of the body. You want that to be even more settled. So you've got to leave it to settle before you even would want to go in to do surgery, just from the surgical point of view, let alone the fact that you need to let it settle. So 2 months, way too early. Big surgery you've had, 2 months way too early. Exhibit A. Exhibit B, I've got a bulge in the lower tummy, looseness when I sit down. Okay, bulge in the, I mean, for bottom line, Nick, talk to your surgeon about this stuff. This is number one stuff. I feel uncomfortable talking about this stuff for someone who's 2 months post-op. You need to be working with your surgeon, and they need to be examining you, seeing what's going on, because it's difficult for me. I'm just talking into, just on the words on the screen. So, really your surgeon is the best man for the job, and I would imagine would want to help you out with this rather than you going online talking to some random guy, about your surgical result for this, this person who's, there's a guy out there who's done your surgery who will be, wanting to help, I'm sure. So that's the first thing. But I'll talk in general terms, Nick. So in general terms, bulge in your lower tummy. I'm thinking swelling, Nick, my friend. 2 months post-op, swelling. You might think, oh, I don't think it's swelling. I think it's fat. I think it's this. I think it's too much skin. I think it's all that. I don't think it's swelling. I don't think it's going to get better. Doesn't matter what you think, because you're too soon for a revision anyway. So you're going to have to leave it a few months anyway. So think positively. Let's hope that it's swelling. And as you say, the fact that it gets better with the ab board and the binder, etc., means that does suggest that there is some swelling. So let's think on the positive. Yeah, let's look on the bright side and hope it's swelling. And so that's it. That's that thing. The looseness when I sit down, probably a little bit more of a worry. That now. I do get this sometimes when people sit down and they say, look at this, he's left this here, this skin here. If there wasn't looseness when you sit down, Nick, you wouldn't be able to stand up, right? Now, you've got to be able to bend in the middle, my friend. So you've got to have some laxity there. Everybody does. So everybody, when they sit down, has got a bit of looseness. The other thing I'd say to you, Nick, is that I'm guessing, I'm putting it out there, I'm guessing you've lost a lot of weight. Because anyone who's had a 360-degree lower body lift and a chest reduction has lost a lot of weight. And that means your skin has been stretched. And that means your skin has been damaged. So you're stretching your skin. It's like, I would say an elastic band, but elastic band's not a good thing. What's the thing that loses its stretch? Something that loses its stretch. Like, not even a balloon. A balloon, maybe? Does a balloon lose its stretch? Anyway, it's like something that loses its stretch. So the skin, you stretch it once, yeah, a little bit, yeah, it recoils and pings back. But if you keep on stretching, especially if you stretch it a lot, it doesn't recoil quite so well. And your skin loses elasticity. So that happens with aging and it happens with stretching. And so people who've lost significant amount of weight, their skin has been stretched by the weight. And the skin that you've got left behind, so once you've had that 360-degree lift, they've left behind, obviously, some skin, because you want some skin on your abdomen, and that will not be as good a quality as you might like it to be. And we can't give you back elasticity to your skin. So by definition, your skin will not be as tight and taut as it was prior to your weight loss. I'm assuming you've lost weight. That is something to consider, that there will always be some degree of looseness, and there has to be some degree of looseness when you sit down. Now, when you stand up, if it disappears, I'd be like, it's tricky to fix that, because what do we do? I would ask you, was it tight when you first had it done? Because often it is tight when you first have it done, and then over the first few months, it sort of tends to loosen off. And so if we fix it, we think we're going to make it tight again, why won't it loosen off again? So, that is a bit difficult. So to fix if it is some looseness there. But I would say to you, look, you might just have to accept that skin is not as tight as it was pre-operative, not pre-operatively, pre-weight loss. How long does it take for the swelling to fully resolve? A year to 6, 12, 18 months. Not so much the swelling. That's more. Well, I guess the swelling is probably more. 3 to 6 months, I'm guessing. But it can take 12, 18 months for everything to properly settle, but maybe 6 months for the swelling. Is there a chance the surgeon did not move enough skin? Now, the problem with this, Nick, and it's difficult, and the problem, mate, is that everyone's trying to do their best. I'm sure your surgeon was trying to do his best. And the problem when doing any sort of body contouring surgery is that in trying to do our best, we're trying to make it as tight as possible, because we want you to be as tight as a drum. We want your skin to be really tight, whether it be a breast lift, whether it be a tummy tuck, whether it be an arm lift. It doesn't matter what, a face lift, it doesn't matter. Whatever operation we're doing, body, when we're contouring the body, we want to make that skin nice and tight and taut, but we don't want your wounds to break down. We don't want the wounds to ping open. You have wound healing problems, have months and months of dressings, because that can happen, especially on something like a 360-degree lift. That's a big op. And, there's a high risk of complications. You've got opposing forces. You're going all the way around the front of the back. The tighter you make the front, the more tension you're putting on the back. So you've got to be really careful with a 360-degree lift, not to overdo one or the other. You overdo the back, you're going to ping open the front. You're going to overdo the front, you're going to ping open the back. So it's a really difficult operation, Nick. So, you're saying you've got a bit of that. So we try and make it spot on. We try and make it absolutely spot on. But there's nothing in theatre that tells us how much skin to remove. There's no sort of measure that we go, 15 centimeters, that's it, that's the one. We just have to do it by experience and by feel. And so we're always trying to make it perfect. But of course, it's never always going to be perfect. And there's going to be sometimes where we take it way too much and the wound opens up a bit. And there's sometimes when we take away too little and you have a bit of looseness of skin. So is there a chance that the surgeon did not remove enough skin? Yes, there's a chance the surgeon did not remove enough skin. But he's trying to make sure you heal properly and the thing doesn't all ping apart. So it's I'm sure he wasn't doing it maliciously, trying to, not give you a good result. But it's just difficult to get these things right, and you've had a big op and it's difficult to get it right, and I'm sorry it's not 100%, but 2 months post-op, too soon. Finally, do you perform revision tummy tucks FDL with Lipo, Renuvion and MR? What's Renuvion, Nick? I'm sure someone asked this before and I went and looked it up, but I can't remember what it is. Is it some kind of laser thing? I don't do well, you can probably tell I don't do Renuvion. I'm not a massive fan of Fleur de Lis, I've got to be honest with you, Nick. Not a massive fan. And a lot of this stuff, it is surgeons' views and surgeons' sort of experience rather than factual. I'm not factually saying a Fleur de Lis is bad. There are probably people out there who's got great results with a Fleur de Lis. I've had pretty good results with Fleur de Lis. It's not like I've had a bad result with a Fleur de Lis. It's just I don't like that big scar up the middle, personally. Especially after you've had a 360, considering how your Fleur de Lis. What are you on about? Anyway, I don't know. So maybe, I'd always say to you, Nick, stick with your surgeon. Stick with your surgeon. They're in the best place to help you out, especially 2 months post-op. And good luck with everything. Good luck with everything. Big op, and it sounds like you've done well, and you've done well, and it could have been worse. That sounds terrible, doesn't it? God, imagine if I said that to my patients. Don't worry, it could have been worse. Yeah, but well, maybe you don't know what I mean, but it's a big op, and you could have had more problems. So stick with it, Nick. Stick with it. Right, what's going on? We've got questions coming out of our ears here. I don't want to lose sight of Instagram. Excellent stuff, Tom. I've done that one. Right, what we got? Mrs. K, as on YouTube. Mrs. K, this is it. This is where the reach really starts kicking off. Brad, you're watching this. Mrs. K's asked a question on YouTube. Hashtag, and not only that, use the hashtag AskJJ. Blooming heck. Mrs. K, could you please tell me what pain relief you offer to patients after a tummy tuck? Yes, I could, Mrs. K. So there's two ways the pain comes when you have a tummy tuck. One is the tension of the skin you're removing. You remove a big bit of skin and it's under a lot of tension. If you saw the surgery, we have to sort of break the table, we call it, which means to make you sit up, sort of bend you up, bend you like that. So there's no tension in your tummy. So one source of pain is that. So when someone's in pain in recovery, the first thing I always say is, let's put more pillows under the knees. Let's sit you up a bit more, because maybe taking the tension off there can help. The other source of pain is from the muscle repair. We call it a muscle repair. It's not really a muscle repair, but it's bringing the muscles together, bringing the rectus abdomini muscles together. And they're often a bit splayed apart, and you have to suture them together. So that can be a bit uncomfortable because you're suturing those muscles together. And so I will inject local anesthetic into the rectus sheath, sort of around the muscles to try and help that pain. So those are the first two things that are quite effective: local anesthetic into the rectus sheath and bending you more if you're in pain. But obviously, people are often sometimes in a bit of discomfort afterwards because it is such a big op. And there's a variety of painkillers we can give you. Now, I've got to be honest with you, you might think I'm like, oh, what's he on about? I like ibuprofen and paracetamol. And I know what you're thinking. Oh, that's headache tablets, mate. Come on, give me something better than that. Now, they are good painkillers. and hopefully it just feels tight, it feels uncomfortable. And I like ibuprofen and paracetamol. So if you can be controlled on ibuprofen and paracetamol, great. Often you can't, and often you need stronger painkillers. And if you need stronger painkillers, no problem at all. We can give you stronger painkillers. The problem is stronger painkillers are usually then you're going into the opiate type of painkiller. So opiate type of painkiller means codeine, means morphine, that sort of thing. And the problem with opiates is they can have side effects. Well, all painkillers can have side effects, and particularly with opiates, they make you feel dizzy, they make you feel sick, and they can make you feel constipated. And constipation after a tummy tuck can be worse than the pain. So be careful. If you're using a lot of the opiates, you need to keep yourself regular. Drink plenty of fluids, kiwi fruit, orange juice, keep yourself going. So the sort of painkillers then, so you'd start with the sort of codeine phosphate, which can either be just codeine phosphate on its own, or you can have a combined codeine phosphate with paracetamol, which is cocodamol or codidamol. There's some type. One's codeine phosphate, one's a different type of codeine. But anyway, one of those codidamol, coproximol type ones, and then you've got your tramadol, you've got your morphine, which can become as an injection or a sort of liquid, which is the Oromorph. So there are other types of more stronger painkillers if you need. But I would say to you, obviously, if you don't need them, don't take them. But if you do, then that is absolutely fine. Hope that's helpful. Got that? Right, where I don't know. We need a queue system here. It's like I was at the car park yesterday. I had to do it, not yesterday, Monday. I had to do a list at the Parkway, and it was an afternoon start. I'm not used to an afternoon start. And they got one of those car parks where you've got to go round and round, and it's just a complete lottery whether you get a space. If you pass the space and the guy comes out and you've just passed it, and the bloke who's just driven in 5 minutes ago goes straight into that space, you've been there for 10 minutes. Oh, I hate that. Anyway, it's a bit like that because I don't know what's going on with Instagram versus Facebook. But anyway, let's do a bit of Instagram. I tell you, I'm getting overwhelmed. I need some help. That's it. Better. Right. Okay. You do one of them and I'll do the other one. Right. Oh, God, phew. I've just duplicated myself on Instagram. Get rid of that. Okay. Which implants? This is Aggie MC, Master of Ceremony, Aggie. Which implants op methods are best for reducing capsular contracture? Thank you. The risk of polyurethane foam, Aggie MC, are the best. So the rough surface of a polyurethane foam implant has got a foam coating around it, which is extremely rough and will reduce the risk of capsular contracture. They're much less likely to go hard than the other types of implants. A bit like the muscle thing, Aggie, I'd be a little bit careful about someone telling you that one sort of implant is the best. So polyurethane implants, in terms of capsular contracture specifically, they are the best. The problem is the rough surface is implicated with ALCL, which is a very rare cancer associated with implants. So the smooth ones don't get ALCL. So some people say, I want the smooth ones. Fine. The smooth ones, more likely to get capsular contracture. Oh, I don't want to get, I've got, so you've got to shoot. And then there's smooth ones and there's polyurethane foam ones. And in between, you've got textured silicone ones, which are like the smooth ones, which are smooth silicone, but the silicone coating is textured, is roughened, and you can get different degrees of roughness. So you can get macro textured, which is very rough, which is more similar to the polyurethane. So it's got a lower risk of capsular contracture, not quite as low as the polyurethane, but lower than the smooth ones. And then you've got micro textured, which is a bit rough, which sits between the macro and the micro. Bit of a nightmare, Aggie, to be honest with you. But basically, answer to your question, polyurethane foam is the simple answer. What am I going to do? I've got Jane asking a question about Portugal. Jane, can you bear with? I've got a question on Instagram here. Hi, hope you don't mind me asking, what type of sedation do you do? Asking this as don't want to be put to sleep, fear for a TT. Amy Lou, I've got to be honest with you. Corinne, I haven't forgotten the YouTube questions. Thank you. Oh, I've done the YouTube questions. Yeah, that was Mrs. K. I don't know what type of sedation. So that is done by a anaesthetist, and they do whatever they do. I think it's propofol. I'm not sure. But if you were considering it, you could talk to the anaesthetist, Amy Lou. I've got to be honest with you. For me, tummy tuck is top end in terms of local sedation, and I'm not, I'm like, I think for a tummy tuck, I feel more comfortable with GA personally. I know it can be done, and I have done it, and it is, you know, it is a doable one with local and sedation. But you know, we could have a discussion, and if you really are worried about being put to sleep, then it can be done at a local and sedation. But in terms of what type of sedation, I don't know. I don't get involved with that. I leave that to the anaesthetist. But we could let you speak to the anaesthetist, and they will be able to help and answer that question a lot better than me. I haven't, Corinne, forgotten the YouTube question. Waving, Jackie's here. Good to see you. Comedic dental, good. Nick, we've done you. Jane, you've been waiting patiently on the sidelines. Thank you. Let's have Jane on the stage, please. Hi, I live got cramp again. I live in Portugal and come over to UK a lot. Oh, this happened the other week, didn't it? Okay, I live in Portugal and come over to UK a lot. I'm looking into a tummy tuck in UK. How long will I have to stay in UK for after the operation? Also, do you do online consultation? Thanks, Jane. I was 14 stone and now down to 11.8. I've been told I need to lose another 8 pounds, which I'm finding difficult. Oh, God. Jane, the first thing I'd say, Jane, is why don't you have it in Portugal? I normally tell people who are in the UK thinking of going to Portugal or thinking going to, you know, wherever, not to go abroad for surgery and to have it close to home. And the same is true when people ask me about having surgery and they live far away. I would say to them, why don't you have surgery where you are? I'm sure there are very good surgeons in Portugal. So that's the first thing I'd say to you, Jane. Why not have it done in Portugal? Nevertheless, I'm going to ask the question. How long will I have to stay in the UK after the operation? So you have the operation whatever day. It's difficult. So it's difficult. You have this operation on whatever day. You'd stay in hospital one night, maybe plus or minus. Well, probably not minus. You know, one night or so. You'd have drains in. I use drains. Take the drains out before you go home. So then you stay in hospital a night or so. Then we normally see you a week later. Take the dressings off. Check the healing. But it might take a couple of weeks to get healed. I mean, the safest would be 3 or 4 weeks, but I don't know if that's a long time. But then, you know, even then, and the answer to your question is yes, we do online consultations. So we can keep in touch online, and it might be absolutely fine. But it's just a bit of a palaver if there's a little dog ear or something like that. I mean, if you're coming over to the UK a lot, if there's a little dog ear or the scar's not settled right, it is nice to see you. But yes, we do online consultations, but you definitely have to come to the week post-op consultation, dressing clinic, and then we'd want to see you probably just healed. So if you could do 3 or 4 weeks, that would be good. You've also got to be aware that a tummy tuck's got a high risk of DVT, which are clots in your legs, which can fly off into your lungs, which is also a risk when you're flying in a plane because your legs are sort of bent. So you have to keep your legs moving, keep everything circulating, and be aware of that. So you don't want to go flying too soon after a tummy tuck because that will increase your risk of DVT. And you need to get your weight right first, absolutely right. And it is difficult losing the weight. I can appreciate that, but well done on your weight loss so far. And but it is good to get your weight right first. But I would think about maybe having it in Portugal, to be honest with you, Jane. Kaz, hello. Is it true you have to change the implants after 10 years? One of my questions, Kaz. Thank you for that question. No. It is not. I don't know where it comes from, and I don't know why people always say that. But let's keep Instagram happy. Let's do a bit of. Come on, let's have a bit of snowfall. Come on, bit of snowball on paper. I don't know why people say that. I really do not know why people say that. But it is not. It is not true. What is true is they might start to go hard. I mean, that's the main reason you're going to need to have to change. I guess the 2 reasons you're going to have to change, the 2 commonest reasons you're going to have to change, is going to be rupture and capsule contracture, which is scar tissue forming around the implant. And if you guess the gibberish. What's that? Sorry. If you have a rupture, the size, the shape changes, and you know about that, but that's relatively uncommon. And so probably the most common reason to need to have your implants changed would be capsular contracture. And it does take 5 or 10 years for capsular contracture to occur. And so it's not unreasonable before you're having surgery to be aware that in 5 or 10 years you might need another operation. So that is, I think that is a fair, thing to be aware of, that you might need more surgery. But once you've had surgery, you don't have to have them changed in 10 years. No, Kaz, you don't. And furthermore, personally, and this is a personal thing to me, I don't routinely scan people or investigate them for the implant integrity. Can I change? What's the ingredient you need to work on most in 2022? Can I change the wording? Sorry. So the most common thing that you're going to need is surgery for capsular contracture, but it is not necessarily going to happen at 10 years. So what I do is I offer people. I've got to turn this stuff off. I offer people follow up. I keep an eye on people and say, look, you can come back to clinic and I'll examine you. And if you get a capsular contracture, the implant will feel hard and it'll be uncomfortable, and you're going to want to have it changed. There's no scan or any test that we can do that tell you need to have your implant changed. So you'll know about it if you need to have your implant changed. It's just once you've got the implants in, be aware that you might need them changed at 5 or 10 years, but there's nothing that happens at 10 years that you need to have them changed. It's not like it's not like they wear out or anything like that. It's just your body forming scar tissue around them. So that is that. Thank you, Corinne. Hilarious. Turkish. I love Turkish Delight, not the proper stuff. The fries. Oh God, that is dangerous. Bought a 3-pack and ate them all. I feel like I'm unburdened on this that I did that. I'm not proud of them myself, but no one else liked them. And you know what? I bought a 3-pack and I knew no one else liked them. Bought a 5-pack of cream eggs and ate them all as well. This is all over the Christmas period. I want you to know it's not a routine thing for me. It's just I just let loose. I just let go, and not proud of myself. But not tonight. Not tonight. I didn't, Corinne. This is in the past. In my, like ages ago. But I'm feeling the Turkish Delight very much so. Look at this comment on YouTube. Very grateful for comments on YouTube. I want to make that quite clear. But this is VAWR.TECH with a variety of upper and lower case. Not sure what that means, but Ashley Lucas, thank you for the comment. Brilliant. Sophie Sinclair, will you do laser lipo in the future? I think I can. Never say never, Sophie, because I know what'll happen. If I do, you will all drag it up, and the Daily Mail will come back with this Facebook Live here that I said that I wouldn't do it in the future. So never say never, Sophie, but probably not, Sophie. Probably not. I don't, to be honest with you, from a surgical point of view, I don't see anything that it can do that I can't do already. They do say that it causes some degree of skin retraction and it does help with abdominal liposuction. Not sure about that. So whether that's the case, fine. I always tell people to go and talk to people who do laser liposuction to see if that's something that they found has been the case. And if so, then that's fine. But on a personal level, from a surgical viewpoint, I don't think it will allow me to do anything that I can't already do. So I can't see myself doing laser lipo in the future, Sophie. But who knows? Tomorrow's a mystery. Yesterday's history. Today is the present. Yeah. We need to clip that. That's an inspirational video right there. Nick, that's a terrific answer. What, to the basal lipo? No, I'm assuming it means your one. Thank you. Surgeon said same things you said. Thanks so much. I'm glad we're aligning. We're aligning. Me and the surgeon, we're aligning. Good. Lisa, what you got? Hi, JJ. I had a client consultation with you regarding what? Client consultation? Anyway, regarding my revision and my FRA of another hematoma. I had surgery 2 weeks ago, and would you believe I had another hematoma, was caught straight away, needed another op, but no blood transfusions or near-death experience, thankfully. A client is online, isn't it? How long do you think swelling takes to go down? It still looks uneven. If so, what would be my options moving forward? So Klein, I'm going with online consultation with you regarding my revision and my FRA, not sure, FRA, something of another hematoma. Two, I can't believe that, Lisa, another so you had a hematoma first time and then got another one. God, what are the chances of that? You've got to go and get a lottery ticket, because that's, maybe that's not, but call straight away, you need another op and no blood transfusions. Excellent. It's a problem, Lisa, because you've had 2 ops in a short period of time. When you have a hematoma, you have to go back and have 2 ops in a short period of time. So it does take longer for the swelling to settle. Again, Lisa, I say what I said earlier on. Work with your surgeons, stick close to the surgeons. They know exactly what they did, and they know what they know what's going on, and they can examine you, etc., etc. But it's going to take months for it to settle. It still looks uneven. It often does when you first have it done. So we're talking months, Lisa. We're talking months for the swelling and all that to go down. Still looks uneven. What's my options moving forward? Got to be honest with you, Lisa. When people have a lot of problems, and I know you've had a lot of problems, sometimes you've got to think, let's just sit on it, sit on it for 6, 12 months, and then see where we are and just see if we can live with it. Because sometimes if there are it gets the law of diminishing returns sometimes, Lisa. If you're chasing this uneven thing, and it was uneven before, and now with a revision, I've got a hematoma, now it's uneven because you can have scarring all over the place. Scarring is unpredictable. Scarring will settle, will get better, will soften, but it's very hard to fight scarring, and we're fighting scarring with scarring. We're giving you more scarring. So sometimes you've got to say, you know what? I've had these revisions. I keep on getting hematomas. I've had 2 lots of hematomas now. My God, it's still not 100%. But do you want to go through any more? Is it worth going through stuff? Hopefully, things are better each time you have something done. But it does get to be the law of diminishing returns. When you have your first surgery, you get a big improvement. But then revisions, it's often smaller improvements. But the risks are always there, and you're doing more and more surgery, more and more scar tissue, more and more difficult to give you a nice, soft, natural result. So, yeah, that's where I am, Lisa. So sorry to hear about the hematoma, but I'm glad they sorted it out quickly. And good luck with that. Sarah, hello. I would like a tummy tuck this year. I'm a nurse. How long would I need to take off work for this? Thank you. Nice question, Sarah. To the point, nice, succinct. So, fear. Big op, Sarah. A tummy tuck. Obviously, not obviously, but there are different types of tummy tuck. You've got mini, full, and then other ones. I'm assuming full. Most people have a full, I would say. So first week, obviously nothing. Come back, take the dressing off, check it all. Probably 2 weeks for the wound to heal. After 2 weeks, you can start doing stuff. Now, a tummy tuck's quite a big op. So I normally say it's 2 to 3 weeks before driving, things like that. So the first thing about going back to work, I'm guessing you drive. Most people do. So I would say to be safe, and it always is difficult. You might be okay at 2, but probably to be safe 3 for driving. So 2 to 3 weeks for driving. And then you're going to feel uncomfortable, Sarah. You're still going to be a bit hunched over, a bit uncomfortable, and you're not going to be doing anything lifting. So obviously as a nurse, you might, and we can give you a sick note and say, look, 3 weeks off, 3 weeks light duties or phased return or something like that. Because if there's anything you can do, can you do an office thing, or, can you do a sort of non-patient facing? So if you can go in and do non-lifting, basically, then 2 to 3 weeks, but it's 6 weeks for lifting. So if you can't, it's 6 weeks. So it is difficult as a nurse, because I know you often, someone might fall over in front of you or something, I guess, and what are you going to do, sort of thing. So you really don't want to be doing any lifting or any sort of handling or anything like that for 6 weeks, I would say. I know that, I don't know if that's probably not what, I don't know what you want to hear, but that might not be what you want to hear, but it does take a while to get sorted out. I did get the online consultation, Lisa. I didn't get the fear of another hematoma. I got it now. Susie is looking forward to seeing me on Friday. Likewise, Susie, very much looking forward to it. Can't wait. Jane, because I wasn't comfortable with the surgeon I saw. What was the question again from Jane? Oh, you live in Portugal. Okay, got it. Yeah, I mean, there are, you know what, a lot of people, when you say to people, don't go to abroad for surgery, you know, everyone says, oh, botch this, botch that. You know, there are good surgeons in Portugal and there are bad surgeons in Portugal, and there are good surgeons in UK and there are bad surgeons in UK. And it's the same in Prague and in Turkey and in, I don't know, wherever else people go abroad for surgery. So there are good and bad surgeons everywhere. And it's not that everybody in the UK is good and everyone in Portugal is bad, and, you know, so I would say see others, Jay. I mean, if you're coming over a lot, I mean, if you want to have it done in UK, you can. I mean, I think we are very good with our standards and things, and it's difficult to know what the standards are like overseas. I know nothing about Portugal and what their standards are, but, you know, the standards are high in the UK. So I'm not saying don't have it done in the UK, but it would mean you would have to be here for a few weeks afterwards. And, you know, if you live in Portugal and you have a little bit of scar thing and a bit of a dog ear, it's just easier to go down the road to the clinic and get it fixed rather than having to come back here. But so yeah, if you won't come for the surgeon, look for others, Jane. Look for others. But yeah, you could have it done in the UK. Anna Lee, would it be too soon to go abroad on holiday 9 weeks after a tummy tuck, please? It wouldn't, Anna Lee, but you will be a bit uncomfortable still. I think I normally say 6 weeks is sort of where you want to be. So then I think, you know, 9 weeks would be okay, but you'll still be a bit uncomfortable. So if you go on a holiday and you want to have fun and you want to lift the bags and you want to do an excursion or you want to do the water slide or something like that, you might be a bit uncomfortable, and you'll probably still be a bit swollen and your scar will be quite red and you won't be, you know. So if it's a big holiday and you want to have fun, I would say, you know, you want to leave it a good few months, you know, 3 to 6 months really, for things to really properly start to settle. So, you know, 9 weeks is okay. But, you know, particularly if it was a sort of work or something like that. But for a holiday that you want to have fun, you're probably still going to be uncomfortable. You could do it, but you probably still be uncomfortable. Sarah, thank you. Well, thank you for asking the question, Sarah. Very kind of you. This is a comment I got on my blog, which I'm very grateful for. And the blog was talking about breast reductions and do we take the nipple off? And this person has said something, I can't remember how they put it now, but they basically, I think they were saying, you know, can you put the nipple back on again? So I asked for a bit more information. I don't know if we've got any more information on that, but I'm assuming they haven't got a nipple. So it might be that they've had a cancer and a mastectomy and a breast reconstruction, which never has a nipple, and you would always go and reconstruct it later. Or it might be they've had a breast reduction and they've lost the nipple. Either way, I would always say stick with your surgeon. So if you had a breast reconstruction, you'll have a breast reconstruction surgeon. If you had a breast reduction, you'd have a surgeon. You know, I used to do in the NHS. I did breast reconstruction and did an awful lot of nipple reconstructions. And so, you know, can we do a nipple reconstruction? Yes. Got to be honest, it's quite a while since I did one. Between you and me, by quite a while, I mean 2022. 8 years. 8. Did I get the clinic? Yeah, something like that. 7, 8 years. So, you know, I can show you some of my results, but maybe I'm not the right. Maybe I'm just, you know, maybe I'm not the right person to be doing a nipple reconstruction. It's a pretty simple operation done under local anesthetic, and it usually needs. Well, the way I do it, I make the nipple, which is the bit that sticks out, and then tattoo for the areola. which you need to have a tattoo. We have got a tattoo person that we refer patients to, but again, for a nipple reconstruction after a breast cancer, you'd normally be in a scheme with the breast reconstruction surgery. For a nipple reconstruction after a breast reduction, that's a little bit different and a little bit more difficult, because you're basing the nipple reconstruction on scar, because you have had the scarred area of where the old nipple was. So that's a little bit more difficult. So again, definitely happy to advise on that. Often what I would say is things like tattooing and things, because we can do sort of 3D tattoos, which obviously doesn't have the projection, but it does cosmetically look probably the best. But it is difficult to make the nipple, the bit that sticks out, in a scarred area. So it's a little bit more of a difficult area. So something I'd be very happy to talk about and advise on. Whether I be the one doing it, maybe probably better to see your original surgeon, whether it be a breast reconstruction or a breast reduction. But happy to talk about it, but it's not really my niche. Yes, my niche is cosmetic breast surgery, and yes, I do breast reductions, but hopefully I don't really be having to reconstruct nipples for breast reconstructions. For breast reductions, it's mainly for reconstructions. Do we offer a procedure for loose skin starting in the under area of the chin? No. Specifically answering your question, no. Are there procedures? Yes, there are procedures for loose skin under the chin. The first thing will be liposuction, hoping that skin recoils, and the next thing will be a face lift, which will, face and neck lift. But we don't do that. It's not my bag. Haven't done it. Again, a bit like the nipple thing. You do these sorts of things in training, but I haven't done it for many years. I'm mainly breast and body contouring. Yes, I'm breast, but in terms of the nipple reconstruction, that's different. That's breast reconstruction, which is what my forte used to be, but it's mainly cosmetic breast now. But anyway, I'm digressing. It's there. Might as well say. So yeah, faces, no. So that would be either liposuction or a facelift, but it's not our thing. And look at this. The last question: do implants need to be changed every 10 years? We've done it. We've done that question. No, they don't. But if you're before you have surgery, you've got to be prepared for it to possibly need to be changed every 10 years. But if you've already got implants in, you don't have to have them changed every 10 years. But it is good to stay close with your surgeon and get them checked, etc. But to be honest with you, if you have a problem, you will know about it. If they don't feel hard, if they don't feel uncomfortable, if you haven't got a swelling, if you haven't got a lump, then you're all right. If you have got any of those things, you need to get it checked out. That was a bit, I mean, I don't know about you, but I felt that was a big one. It's bright. Oh, that's better. That's better. Oh, it's so bright there. So thank you all for contributing. Very grateful to everybody for putting their oar in. I am going to go and see if I can get the second episode of Antiques Road Trips, it's 56, in, and I suggest you do likewise. That's channel 17. If you have any questions, please post them here on Instagram or here on Facebook/YouTube. Corinne has come in at the last minute. Smashing Q&A again, JJ. That's the sort of support we need. Thanks for the answers. Really appreciate it. As always, have a great week and see you soon. Thanks so much. Great Q&A. Jackie, #1 fan. Thank you. My #1 fans are out on Instagram. Thank you very much. Very kind of you to say. And I will see you all next week. I'm just trying to think what's happening next week. Probably, I don't even know what's happening tomorrow, let alone next week, but presumably more of whatever was going on this week. So I'll be here at 7 o'clock. I will see you then. Have a lovely evening. Love you big time. Jace Staiano signing out. Sign out. End the chat. Facebook. Loving your work. See you next week. And YouTube. Thanks for the YouTube comments. Even that weird one. Thank you for the YouTube comments.